Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about something I've talked about frequently in the past, and that is that steroids are really bad for us. Certainly there are scenarios where like asthma, certain types of infections, but for musculoskeletal injuries, we use steroids all the time, but one of the things most doctors and certainly most patients are not aware of is that they actually damage the joint or the muscle or the tendon or the ligaments that we're trying to protect. Yet we use these quite frequently, and yet, gosh, this information's been around for decades now. And so, why do we still use them? I think part of it is that, again, most doctors are not aware that even a single injection given in the buttocks can permanently damage the soft tissues of the shoulder. If most of us knew that, we would not be using these steroids as a standard for care. Now we know that, you can't have more than 3 injections in the shoulder because it increases the risk of a rotator cuff rupture. Well, why is 3 the magic number? It's not. The first one does, the second one does, the third one does. It's just past a certain point, we find that the damage or the potential downside outweighs any potential upside. And I think if we looked under a microscope, we'd find that almost every scenario, the downside is outweighed, or downside outweighs the upside. So, if steroids destroy tendons, so what can we do to rebuild some of these tendons? I happen to be a really big fan of eccentric strengthening, the idea of a muscle lengthening under a load. So the analogy I usually give is, if I gave you a 50-pound boulder and said, don't let it hit the ground, it's going to, but you're going to struggle, your muscles are going to contract while they're lengthening. That's an eccentric contraction, and it's been shown to strengthen the tendons and soft tissue surrounding a joint. So it's something that I frequently recommend. There's been an increasing use of regenerative therapies, things like stem cells, and exosomes are the packets that are released from stem cells. So you can consider them like an acellular product. There's no actual stem cells in it, but it is the exosomes that do a lot of the work. So researchers looked at whether or not the use of adipose-derived, so fat tissue-derived stem cell exosomes could protect against glucocorticoid damage to the tendons in the shoulder. And they found that it turned around all of the damage done from the glucocorticoids. So think steroids, think steroid injections. And of course, that's great news. So their suggestion is, well, maybe we could give them both together. Of course, exosomes are far more expensive and not realistic for most people. But my thought is, why would we use them in the first place? I've been in the martial arts for 32 years. I've been a chiropractor for 24 years. I've had my share of injuries. I've never felt the need to even take an ibuprofen, any type of anti-inflammatory, let alone a steroid injection. So there are a lot of other options for things that we can do to heal. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.